So we have a great show coming up. We have doctors calling in, and I want to talk a little bit about like flibanserin or Addy that was approved in America yesterday. Yes, women also have their female Viagra. FDA was under a lot of pressure because they thought it was discrimination, that men have all these medications, but women have none of them, and finally they caved in. This is a medication that you take every day, not when you need it. It's not as needed. Flibanserin or Addy is out there. It basically works on your brain by changing some of the hormones such as serotonin, and it can improve your mood, it can improve your libido. And but there are issues with this because there are side effects. You can't take it with alcohol, and doctors need to be trained in this particular field in order to prescribe it. I think whether this medication is going to take off or not, it's remained to be seen, but it's really a historical event because it's opening the gate to a lot of other medications for female sexual activity. I think female sexual libido is totally different than men. With men, it's more mechanical. You have obstruction, the blood doesn't get in, you take these medications and it works. With women, as we know, it's a lot more complex because women are more complex. And it's more like psychological and more mental. And sometimes a 5-carat diamond can get the sexual libido going, okay? It's not all about like just taking the medication. So if they feel comfortable with the partner, if the partner makes them feel sexy, then you have the whole engine started. If you're women out there and you have opinion about how to start the libido or jumpstart the engine, call in 877-970-2999. I think it's quite important to know whether this medication or not. Now, in the study that they had, the improvement was 1 great pleasure a month. So you want to be careful about whether this is the one that you want to go to and you want to talk to your doctor. All right, let's go to some of the callers. I want to answer some of the few calls. We have